following program is produced in cooperation with the University of Minnesota Academic Health Center, a leader in the dissemination of knowledge. The University of Minnesota Medical School, teaching tomorrow's physicians. The Minnesota Medical Foundation, supporting health-related teaching, research, and service. Fairview Health Services, a world-class healthcare system. And University of Minnesota Physicians, a multi-specialty clinical practice group.
Hello, I'm Dr. Greg Versalati from the University of Minnesota Medical School. Welcome to a Health Talk and You program that we think is one of our classics. This program on taking medicine is hosted by Dr. Jim Pacala. Let's join him.
I'm Dr. Jim Pacala, sitting in for your regular host, Dr. Greg Versalati. Welcome to Health Talk and You. This is a weekly program that gives you a chance to direct your questions to some of the best and brightest minds in the field of medicine. Our topic this week is taking medicine. Every day, millions of Americans rely on medications to feel better and get well. Drugs can be wonderful tools for people of all ages, but it's important to remember that while drugs may be able to help you, they can also hurt you if they aren't used right. What should you do to get the best results from medications you may be taking? That's one of the questions we'll be asking our guests, and I'd like to introduce them to you now. Dr. Joe Hanlon is a professor in the College of Pharmacy at the University of Minnesota. Welcome, Joe.
Okay.
Nikki Vetter is a pharmacist at Fairview Pharmacy Services. And Dr. Pat Fontaine is an assistant professor in the Department of Family Practice at the University of Minnesota. At the end of last week's program, we invited our viewers to call or email us on the subject of taking medicine, and we received many interesting questions. I think we'll start this one from Bob in Bloomington, who's feeling dizzy.
I have been troubled with intermittent short spells of dizziness and daily fatigue since having left carotid artery surgery a year ago. I am also taking the following drugs: Atenolol, Pravachol, Coumadin, and Lorazepam nightly. Is it possible that any one or a combination of these drugs are causing my problems?
Joe, what about it? Could these medications be causing Bob's problem?
Well, it's a good question. Dizziness is one of those symptoms that's so common in many patients, and medications can be associated with them. Medicines might affect your blood pressure. I noticed that he's taken one medicine that can affect blood pressure, the Atenolol. But also some other medicines are a little trickier in that they can affect the way your thinking and memory is and your balance. And particularly, there's a class of drugs that's called benzodiazepines. And he's taking one of these medicines, Lorazepam, and especially in older people, it can cause problems with falls as a concern.
So for Bob, would you have him talk to his doctor? He's on several medications at the same time.
Oh, absolutely. The most important thing with people taking medicines, if they have concerns about their medicines, is to speak to their physician about them before making any changes in them.
Great, great. Nikki, Pauline from New Hope writes, should I take my medicine before, during, or after meals?
With most medications, it's best to take with food unless there are special considerations with the medication. And I think it'd be a good idea for her to talk to her pharmacist with her specific regimen and get any specific advice.
Great. You know, with the last two questions, we've had people asking about how to take medicines and perhaps even how to remember them. And I have here an enlarged version of something that pharmacists use quite often. This is the actual size. Nikki, do you want to explain to the viewers what this is?
This is a medication reminder device. And this particular model will allow for one slot for every day of the week. And there's other varieties. You can get them if you have a twice-a-day regimen with medication, up to 4 times a day regimen. And what's done with these is you fill it up beginning of the week, got all your medications in it for that day, and it's a helpful reminder to know what you've taken what day and what needs to be done. So they're really helpful device.
Great.
Jim, one of the things that we've seen with older people is that those pill boxes can be really helpful for family members in terms of trying to help monitor things. And they actually have pill boxes like that have 4 slots per day. So
Sure.
even with the most complex regimens, they can be really helpful.
Or even different colors for morning and evening
Absolutely.
can help you out.
I noticed that that one has very large letters so that if someone were visually impaired, they would be able to still see which day of the week and take their medications themselves. And it's a nice large box for people who are taking many pills per day. Even young people, though, have difficulty remembering to take a pill sometimes once a day.
Oh, I know. I'm
And-
one of those people. I hope, well, anyway.
People have busy lives, and sometimes I'm talking to patients saying, when I find they're having difficulty, their medication isn't working because they're skipping doses, we'll actually sit down and look at their daily schedule and say, is there one time or one event that
Right.
happens at a consistent time every day that you can time taking your medication to that event?
Let's take another audio question. In fact, we're going to take 2 audio questions, one from Lois in Mankato and a related question from Lucy in St. Paul.
I had a hysterectomy 2 years ago. What medicine should I be taking? Thank you.
I would enjoy hearing the doctors discussing Prempro. It seems amongst us women to be a little controversial. And, they say on the one hand, it's similar to what we're taking now, Premarin and Provera, and yet when you see all the side effects begin to wonder.
Pat, I have a box of Premarin, the old standby that the second caller was talking about, and the other medication that she was mentioning, and that's called Prempro, which is one of the newer medicines on the market, and sometimes women with hysterectomies are recommended to take this. Could you answer their questions?
I think they're 2 very interesting and related questions about hormone replacement therapy. And I think we can start with the difference between Prempro and Premarin. The Prem, at the beginning of the name, comes from the Premarin, actually the whole word, indicates that this estrogen preparation is actually a natural product, but it's an animal-derived product. The estrogen in it is derived from pregnant mare's urine, and hence Premarin. That turns off some people, some of the animal rights activists. Some of my patients have actually come to me and said, I don't want that one because I don't like the way the medication is collected. The Premarin is the pure estrogen preparation, and it would be appropriate for someone who wants the benefits of hormone replacement therapy, the very clear benefits that it has for preventing osteoporosis, for instance, the somewhat less well-known, but still some evidence showing that there's benefit for heart disease as well, heart disease prevention. Someone with a hysterectomy only needs the estrogen replacement. Now, the Prempro is a combination of the estrogen and it has Provera, a progesterone component, which when added to the estrogen lessens the risk of endometrial cancer or cancer of the uterus.
Great.
I'm sympathetic to the question about, we understand Prempro is just the combination of the old Premarin and Provera that we used to take. It really should be because it actually is an identical dosage to what was previously prescribed.
So it's 2 old medications combined into 1 tablet.
That's correct, although if you go back a little further, the progesterone component used to be prescribed only like for 2 weeks out of the month and in a higher strength. And the Prempro actually has a lower dose continuously.
So you can just take it all the way through the month.
Take it all the way through the month, very convenient, and it should actually have fewer side effects related to the progesterone component.
And if I could add, I mean, the dial pack also is a convenience factor in terms of trying to enhance compliance, so you can check and see how many tablets you've taken if you've taken that tablet that day.
Terrific. Did you have something to add?
Also, yes, for those patients who are concerned about the source of Premarin, from the horse's urine, there are synthetic estrogens that are available. That's an option for those patients.
Terrific. Joe, I have 2 questions for you that are related. Jackie from Minneapolis writes, anti-inflammatory drugs bother the stomach. Are there any that do not? And Martha from Chanhassen writes, I take several medicines which cause irritation to lining of the stomach. Tums doesn't help. What can I do for healing and stopping pain?
Well, they are two different questions, and let's start with the first one. Anti-inflammatories are medicines that can take away swelling and pain associated with that swelling, and there's common medicines like Motrin and Advil that come under that class. I guess my best advice for most people is to really ask themselves the question, or ask their physicians whether they really need something to treat inflammation. If it's pain that they're treating, which is the most common thing, plain acetaminophen or Tylenol is a much safer thing and doesn't cause the stomach irritation. There are some newer agents for those people that do need anti-inflammatory agents that are at risk for having serious stomach problems like ulcers and the like, and they're called COX-2 inhibitors, which is a big, long word, but basically they're new medications that seem to be a little easier on the tummy. The second question you asked is actually a little vaguer, but also a little concerning, is that there's a lot of medicines that can upset your stomach, and as Nikki talked about before, one of the common things to do is to take medicines with food, and that oftentimes will help. But if somebody actually truly has an ulcer or has had a history of an ulcer with a medication, there's some very important things that they can work with their physician to do. There are medicines that you can use to prophylax to prevent future ulcers. There's alternative medicines that are less likely to cause ulcers, and it would be important to sort of chat with their physician about that.
Terrific. Thanks, Joe. We have an audio call from Betty from Minneapolis. Let's hear what Betty has to say.
I would like to know if taking glucosamine chondroitin would have any interference with a blood pressure pill or with Advil.
Nikki, you want to take that one?
Sure. There hasn't been any clear drug interactions that we found with the glucosamine chondroitin.
Tell us what glucosamine and chondroitin are.
Glucosamine and chondroitin are used for osteoarthritis, and they're marketed as a dietary supplement, and their effect in osteoarthritis is in promoting cartilage growth. And there have been quite a few studies on the product, and we really haven't seen any that would question the safety of the product, so it is generally considered to be safe. And there are some studies out there that do show it's effective. One thing patients need to remember, it takes about up to 3 months before we know if this product's going to work. So,
now, do you need a doctor to give you a prescription for those?
No, they are available over the counter. Generally, the dosage that they recommend is 500 milligrams of the glucosamine component 3 times a day.
Great, thank you.
Jim, let me just add one thing. One, it brings up the general topic area about these supplements that are not truly over-the-counter medications, and I think it's important to note that the Food and Drug Administration doesn't license these products, and therefore they do not have to prove safety or effectiveness.
Well, that's one of the things we wanted to talk about, Joe. We wanted to make sure we included in our discussion tonight some information about over-the-counter medicines that you can get without a doctor's prescription, things like herbal medications and dietary supplements. Dr. Bob Sapoli is a pharmacist and a professor in the College of Pharmacy here at the University of Minnesota. Let's listen to what Bob has to say on the subject.
Nervous stomach.
Well, that's fine.
Last year, more people used alternative medicines and herbal therapies and dietary supplements than went to primary care clinics and used prescription drugs in this country. If you've decided to take an herb or a vitamin supplement or some other dietary supplement, there's a couple of things that are really important that you understand. It's important to understand that you're not taking the dietary supplements all by themselves. You often will have other medications, over-the-counter medications that you've purchased without a prescription in the drugstore or the grocery store. You also may have prescription medications that you've gotten from your physician or from your nurse. And so you're not just taking the dietary supplement by itself. So if you decide to use an herb or a vitamin mineral supplement, it's important to tell your physician, it's important to tell your pharmacist, because these medications can interact.
Good advice from Bob. Pat, Stella from Inver Grove Heights writes, does it make any difference which inhaler you use first, Atrovent or Ventolin? I happen to have an example of an inhaler here. These are very common medications, as you know, and They're usually taken when you shake them and you hold your mouth over this opening here, and when you're inhaling in, you press it and it delivers the medication into your lungs. So what about it? Atrovent or Ventolin first?
Well, I might add, as you're demonstrating the technique, that many people use a spacer, a tube between the opening at the bottom of the inhaler and the mouth. Although it seems like, well, it would be a longer tunnel and less medication would get in, it actually improves the delivery of medication, so that we commonly recommend that for patients. Inhalers can be a confusing topic because there are at least 3 broad categories of inhalers, and you've mentioned 2 of them. The Atrovent and Ventolin are in 2 different categories, and there's a 3rd category, which can be a steroid or cortisone-containing medication. And patients need to not double up and take 2 inhalers in one category. And a good question is what order to take them if you have 2 different categories. Generally, we'll recommend doing an inhaler like the Ventolin first. The Ventolin is a beta agonist, as we call them. That means that it goes down to the smooth muscle in your lung, relaxes it so the airways open up, so that the inhaler you take second will have improved delivery.
Ventolin first.
Ventolin first, whether you have the steroid or the Atrovent second.
Terrific. Joe, we've got 2 questions that are related. Jim from Minneapolis writes, comment on the quality of generic drugs. And Bess from Stillwater says, could the filler or dyes put into some generic medicines cause unexpected reactions? What about generics?
Well, I think generic medications are a great way for people to save money. And of course, one question comes up, are generics as good as the brand names? Well, the answer to that for the absolute overwhelming majority of medications is yes. Generics are just fine. They actually have to undergo rigorous testing and have to prove that the amount of drug that's delivered to the human person is the same as the innovator or brand name drug. And there's maybe 5 or 6 medicines where you have some concerns about it, and ask any good pharmacist and they'll be able to give you the specifics about that. The fillers or dyes, rarely, and I mean very rarely, there's going to be things that are put into the tablet to keep it together and the like that people might be sensitive to, but that's usually not a major concern.
Terrific. So you like generics and recommend them?
Absolutely.
Pat, think so?
I would generally agree. I think maybe people need to know that when you say that they undergo extensive testing, it's a different kind of testing. When a drug company markets a new drug, before they market it, they have to prove that it is effective in lowering blood pressure or lowering cholesterol, whatever the endpoint is. When the generic comes out, the testing is actually much less. They just have to prove that it is equivalent.
That's right.
To the drug that's already out there. So the brand name drugs have been really better tested, but by and large the generics are effective and safe, and if the
patient... And less expensive.
And a lot less
right?
expensive. You
but
can't
Pat,
argue that.
I don't want to be contrary, but one of the yes, I do mean to be contrary. No. I think one of the interesting thing is, do you know that the biggest manufacturers of generic drugs are actually brand name pharmaceutical companies? And so that sometimes you will see from a marketing point of view that they sort of talk out of both sides of their mouth. But in general, I think it's important to not make switches between different products.
Great. Let's have a question for Nikki. Nikki, Mary from Eden Prairie writes, do I have to take pills all night if it says take every 4 hours?
No. For the most part, I would say no. We don't want patients getting up during the night. Usually every 4 hours with the medication, that's every 4 hours while they're awake. And there would be a few circumstances under which we may want a patient to take medication through the night, but by and large, no.
Pat, how about that? Is there a way that we can avoid having to get up at night if necessary? Nikki's saying you don't have to, but what if you wanted to make sure that a patient had a medicine in the middle of the night? Is there a way that you could get around that?
Well, I'd sit down again with the patient and say, we would like to have this medication spread out as much as we can around a 24-hour clock. So how can we do that? Maybe by starting earlier in the day, getting up at 6 a.m. and then going through midnight or whatever time, so that there's really a smaller interval. It may be 6 hours rather than 4, but it's still quite close.
Okay.
And the nice thing about most modern drugs, the new ones that come out, besides being more expensive, and I don't mean to be anti-generic, but they often do have a longer half-life, so that there are fewer and fewer drugs where you really do have to take it every 4 hours.
Lots of extended release and sustained release medicines out there that can be very helpful.
Once-a-day antibiotics now. 20 years ago, we didn't have that.
Let's take a quick question from Dorothy in St. Paul.
Which high blood pressure medicine does not affect or lower one's potassium?
Pat, how about high blood pressures and potassium? What's the connection there?
There are certain blood pressure medications that are also diuretics or water pills, and they can, as they're causing you to lose salt and water through your kidneys, cause you to lose potassium too. Luckily, there are all kinds of blood pressure medications that don't cause you to lose potassium. The one you're probably thinking of is Lasix, or furosemide. There are other diuretics as well, hydrochlorothiazide. Sometimes there are potassium-sparing diuretics that can be added to your blood pressure medication so that you will not have to take additional potassium. But if you and your doctor have decided that you need a diuretic that tends to cause potassium wasting, best approach is to look at dietary sources of potassium.
Like what?
Oh, bananas, raisins, a number of fresh fruits.
Potatoes
and
with the skin?
Yeah, that's right, that's right.
Orange juice?
A lot of the things that we should be eating anyway because they're healthy, mainly in the fruit and vegetable category. And then failing that, you can use a salt substitute that has potassium in it rather than sodium. Failing that, you can take a potassium pill if you need to.
Great. Joe, I've got a great question for you. Helen in Minneapolis writes, who is the best one to check with? A doctor or a pharmacist?
Depends on what you're checking with them about.
Oh, both. You can get two opinions.
That's right. Well, I think when it comes to medications, I think the most important thing is to talk to your healthcare professionals that you're working with, and I think it does help to get opinions from both. Sometimes the pharmacist is a little more accessible in terms of being at the corner store or the like. But when it comes to providing information, there's great references that are out there that are accessible to both patients and to healthcare professionals, and you should avail yourself to them.
Nikki, you're a practicing pharmacist. How would you answer that question?
Well, I think it's important to keep all the members of the healthcare team really into what you're doing. And we all play a role. It's a team approach. You know, your pharmacist, your physician, the other healthcare providers that you have, and it's important to remember the team approach.
Pat, do you want to weigh in on this one?
Oh, I agree absolutely. I look at a pharmacist as a very valuable colleague and consultant. I'm a family physician, and as such, we keep medication lists for all our patients, whether it's medication they get from the eye doctor or medication we're prescribing. But for some patients who go to multiple specialists, the only person who knows all the medications that they're on is their pharmacist. You know, they have the list on file at the drugstore, and they're in a unique position to help educate about side effects and interactions.
Terrific. Nikki, Doris from Shakopee writes, can you use an old medicine if a health problem recurs?
In most situations, it's best to be reevaluated by your physician. If you and your physician have agreed ahead of time, where if this symptom recurs, go ahead and take the medication. In those cases, I think it's fine, but you still need to notify your physician that this problem has continued.
You know, if I look in my medicine cabinet, I've got some medicines in there that are 3 and 4 years old. What would you say?
It's a good idea once a year to clean out your medicine cabinet. Throw out everything that's over a year old. There are some medications out there that are actually harmful if they're expired. So you should never take expired medicines.
Once a year?
And just a word of advice, the worst place you can actually keep your medicine is actually in a medicine cabinet in your bathroom.
Yeah, let's hear about that. Why is that, Joe?
Well, a lot of medicines are actually sensitive to moisture and heat. And think about what happens in a bathroom with a shower and the sink and the like. So actually, the best place to keep your medicines is in a normal temperature area like the kitchen or in the top drawer next to your socks if that's where you think you're going to be best able to remember where to take your medicines.
What about the refrigerator? You know, often you'll hear about people storing medicines in the refrigerator, or maybe that keeps them fresher longer. Is that true?
Only those medications that are specifically meant to be kept in the refrigerator should be kept in the refrigerator.
And those are very few.
Very few.
The liquids for children, for instance,
Right.
the antibiotic suspensions, sometimes need to be refrigerated.
Some of them,
Right.
yes.
So maybe the medicine cabinet's the best place for things like toothpaste and your
Razors.
razors and things like that, and you might want to think about a slightly drier place for your other medications.
Exactly.
Well, that's about all the time we have. We're going to have to end it right there.
We're just about out of time, but before we go, let's review some of the important information about taking medicine. First, talk to your pharmacist and your physician about your medications. Let them both know about over-the-counter pills you might be taking in addition to what's been prescribed to you. Secondly, if you are seeing more than one physician, make sure that all your doctors know what has been prescribed by members of your medical care team. Thirdly, set up a system for yourself, like a pill tray, that makes it easy to stay on schedule. Thank you for watching this edition of Health Talk and You. Remember, the doctors are always in on Health Talk. See you next week.